Do you wake up tired every day, even after a full night's sleep? Maybe you struggle with brain fog, jaw tension, digestive issues, anxiety, or even chronic pain that just doesn't go away. What if I told you that the real problem could actually be your airway? So today I'm going to show you how your airway might be the missing link in your healing journey, plus a few simple assessments and tools to help you breathe better, feel better, and ultimately live better. Hi, my name is Dr. Ariane Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and owner of the Movement Paradigm Integrative Health Center. And this is a topic that I have become super passionate about because I see so frequently that this can be the root cause of so many issues. So let's start with the basics. So your airway is ultimately the absolute gateway to oxygen, the most important nutrient of your body. So every system in your body relies on optimal breathing for energy, repair, and regulation. But what if your airway is restricted? Perhaps because of poor tongue posture, because of mouth breathing, because of forward head posture, or structural issues. Your body will find a way to compensate. And compensation is ultimately what leads to dysfunction and illness. So that dysfunction could look like poor sleep for some. It could look like fatigue, posture changes, extreme kyphosis, anxiety, even depression, inflammation, and or chronic pain. So here's how airway dysfunction could show up in your life. For sleep, you may snore, you may mouth breathe, you have poor oxygen delivery, which means disrupted or fragmented sleep and less recovery. You might have digestion issues, so the diaphragm and the vagus nerve are essential for gut motility and enzyme production. So poor breath equals poor digestion. Posture and movement. Forward head posture and poor tongue position can contribute to neck pain, shoulder tension, altered movement patterns. When you always feel like you have tension in your neck, this is a huge sign. Of course, stress and mental health. When you feel like you have shallow breathing that is signaling to your nervous system and your brain that you are in danger all of the time. This triggers this chronic fight or flight response. Inflammation. Without enough oxygen, healing and recovery are going to slow down, leading to more inflammation and even more immune dysregulation. This is why airway health is foundational, not optional. So what does your timeline look like? When I do a functional medicine timeline and I'm looking through someone's detailed history, these are some of the things that I might hear that might be indicative of an airway issue. Did you have ear infections, strep throat as a kid? Chronic pain, bronchitis, pneumonia, frequent respiratory viruses, sinus infections, always a light sleeper. You can't wake up in the morning or you don't feel well rested. You're tired in the late afternoon. You have cravings, sugar cravings, salt cravings, carbohydrate cravings. Early waking, 2, 3, 4 o'clock in the morning, no matter what you try. Panic attacks, especially panic attacks in the middle of the night. Constant anxiety, so you're not able to manage it. Depression, multiple health conditions, endocrine, immune, digestive. You have very poor recovery after exercise. You cannot lose weight. You have significant weight loss resistance and metabolic issues. These are all signs that you should look into your airway health. So let's do a few simple self-checks together. The first is your tongue posture. So where is your tongue right now as I asked you? It should be on the roof of the mouth. So the top 1/3 of the tongue should be suctioned to the roof of the mouth. The lips are going to be gently closed. Teeth are going to be a little bit apart, and it should just be gently touching your top teeth, and you should be breathing through the nose. If your tongue is low or your mouth breathing, that is a huge red flag. We should always be nasal breathing because it's going to help filter and dehumidify the air coming into the body. So now let's look at your actual breathing, placing one hand on your chest, one hand on your belly. As you breathe in, are you breathing through the neck and shoulders? Are you allowing the abdomen to expand, which is 360 degrees? Then we look at nasal airflow. So can you breathe through your nose for at least 30 seconds without having to breathe through your mouth? So this can be a really simple measure. You want to make sure you're able to do this without feeling short of breath. And if you're not able to do that, there may be some type of nasal obstruction, inflammation, or even just habit-driven dysfunction. Your tongue ranger motion. Are you able to bring your tip of your tongue to the roof of your mouth and open wide? and be able to have full range of motion in the tongue. What does your palate look like? So do you have a really narrow, pointy palate, or do you have a nice oval-shaped palate? Do you have a nasal valve collapse? When you breathe in, do your nasal valves on the side collapse inward? They ideally should dilate. And also we can look at the lateral nasal wall. So if you pull this apart, how does that feel? Are you able to breathe easier and freer? So now that you've done a quick assessment, what are some things that you can do about it? Here are 5 things that you can start doing today. First is nasal breathing, training your tongue to be at the roof of your mouth, breathing through the nose during the day and ideally at night, making sure that you're able to breathe freely through the nose. We want to think of tongue posture practice. So the tongue should be suctioned to the roof of the mouth all day long. Try to really reinforce that anytime. You can also add in tongue clicks, where you suction the tongue to the roof of your mouth. This is going to support proper airway space, posture, and even jaw alignment. Diaphragmatic breathing. So practicing your breath in a slow fashion where you can breathe in through the nose, allow 360 degrees of expansion through the abdomen. This is going to help you to activate your vagus nerve, to calm your nervous system down, improve digestion and resilience. We can also use things like nasal dilators. If you found that this type of breathing felt better, or you found that there was a nasal valve collapse, using nasal dilator at night can be really helpful. Xlear is also something that can be extremely helpful, which is a nasal spray that is saline and also a xylitol in it. So it helps to keep the nasal cavity moist. It also helps to manage bacteria in the nose. It can be extremely valuable to promoting nasal flow. And then depending on what you have found through your own self-assessment, you can also use different sleep evaluations. These are basic screens that you can do called the Epworth Sleepiness Scale. You can also use the Stop Bang Scale. You can find those easily on the internet to just assess your breathing and potential airway issues. And then with this, you can, if you found that during this video, a lot of these things resonated with you and it seems like there may be some issues, then please ask your primary care physician for a sleep study. This can evaluate your oxygen level saturations, if you have sleep apnea, if you have upper airway resistance, to be able to really understand and then meet with someone who specializes in airway health, who can evaluate you properly to see why you actually have an airway issue. What is the obstruction? What does your structure look like? And then you can begin to really follow a root cause approach to this. I hope this was helpful. Thank you so much for joining. As always, if it was, please give it a like, give it a share, subscribe to our YouTube channel for more tips like this on whole body wellness through integrative and root cause medicine. And if you're interested in our services, please reach out for a discovery session. And you can also join us in the Movement Paradigm app on Apple or Google. We have lots of free challenges, so many different programs to help you really optimize your health. Thank you, as always.